Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. After more than a year, the governor is lifting COVID restrictions.
We have let data drive our decisions.
But is it too soon? A health expert joins us to talk about new infections, COVID variants, and vaccines. New guidance from the federal government gives caregivers the green light to visit their loved ones in long-term care facilities. But some families say they're struggling with strict policies that make it hard to coordinate visits.
They should want us to be able to see our loved ones, and they should want to be able to have the residents happy.
Restaurants have suffered hundreds of billions of dollars in losses since the start of the pandemic, but industry leaders are optimistic that things are turning around. Ahead, the pandemic's toll on local restaurants and how new federal aid could help those struggling to keep their doors open. Those stories, plus the latest news headlines from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Well, beginning Wednesday, all Hoosiers over the age of 16 will be eligible to sign up for the COVID-19 vaccine. For weeks, the state has gradually been expanding eligibility in 5-year increments. Currently, Hoosiers 40 and older can receive the COVID shot. The state's focus has been on reducing hospitalizations and deaths by focusing on those most at risk. Now, the governor says the vaccine supply is increasing, so it's time to open it up to everyone.
Our federal partners told states to expect large increases in the amount of vaccine that will be flowing to us beginning the last week in March.
The state announced Thursday that more than 1 million Hoosiers are now considered fully vaccinated. That's about 15% of the state's population. In about a week and a half, you won't have to wear a mask everywhere you go and businesses won't have any restrictions. The governor is rolling back the state's COVID protection measures starting April 6th. Brandon Smith reports.
The state is replacing its mask requirement with an advisory, but the state's health commissioner says the science remains the same.
And we've been doing that for the most part across the state, wearing our masks to prevent the spread of this virus to other individuals and prevent ourselves from becoming infected.
Masks will still be required in state government buildings, COVID-19 testing and vaccination sites, and K-12 schools. The state will no longer require restaurants, bars, and nightclubs to keep customers spaced 6 feet apart or seated, though Holcomb says businesses should keep COVID response plans that include safeguards. And local officials can still impose tougher rules in their own communities if they decide that's best.
Ladies and gentlemen, as we continue to do these few things, the light at the end of the tunnel becomes brighter and brighter.
Governor Holcomb says the state's steep declines in coronavirus hospitalization and deaths rates, as well as the growing number of people who are fully vaccinated, justify his decision.
We have the resources to care for those who are in need, meaning ICU beds, doctors, etc. We have a vaccine, 3 of them, as a matter of fact.
Indiana's coronavirus hospitalizations and death rates have fallen by more than 80% since their December peaks. Nevertheless, Indiana still averages about 10 coronavirus-related deaths per day. The state's public health emergency declaration will remain in place through April. Holcomb said that will allow the state to pivot if cases take a turn for the worse. It also ensures Indiana still has access to federal relief. For Indiana Newsdesk, I'm Brandon Smith.
We're joined now by Dr. Richard Feldman, who was the state health commissioner under Democratic Governor Frank O'Bannon. Welcome, Dr. Feldman. You know, the governor has faced a lot of criticism from within his own party about the COVID restrictions that he's imposed. Do you think his decision to lift restrictions is based on science and the best advice from health experts, or is it politically motivated?
Well, before I criticize the governor, I do want to say that for a Republican governor in a very conservative Republican state, I think Governor Holcomb has done really a reasonable job in terms of the mitigation measures and protecting our state, the citizens of our state. However, I think this is unfortunately politically motivated more than based on the advice of public health experts and the science. It's premature, and it's really unfortunate because we're almost there. You know, we are vaccinating. Indiana's had one of the best vaccination systems in the country, and we're almost there. Just a few more months of mitigation, mask wearing, social distancing, washing your hands would be so much better than opening up things, I think, prematurely. Even though the case numbers and the death rates have plummeted, and that's wonderful news, it's still unacceptably high. And I think we have a false sense of security because things decrease so much, but they're still at an unacceptably high level.
You know, you just mentioned about the deaths, they've decreased. It was an 80% drop from December. How significant are those numbers to you?
Well, they're significant. Things are going in the right direction. That doesn't mean that we're ready to open up. And unfortunately, his decision is a punt to local health departments for them to take the political heat, as well as, and think about this, businesses. Businesses were operating under a state mandate for mitigation standards, including, most importantly, mask wearing. Now it's still up to the businesses, but now they're going to take the responsibility rather than the state government.
All right, Doctor, we have to leave it there for now. Thank you very much for your time. We appreciate it.
You're welcome.
Well, earlier this month, Indiana and the federal government ended pandemic-induced lockdowns and visitation restrictions in nursing homes and long-term care facilities, but interpretation varies greatly even among individual facilities. Brock Turner has the story.
The initial announcement was met with both hope and optimism, but 2 weeks after regulators instructed facilities to remove visitation restrictions, many caregivers say little has changed. Throughout Indiana, long-term care visitation policies vary widely. Some are adhering to the guidance, others remain fully closed to unvaccinated outside visitors. The federal government's policy is clear. A memo from the Centers for Medicare and Medicaid Services instructs, quote, facilities should allow indoor visitation at all times and for all residents, regardless of vaccination status, except for a few circumstances when visitation should be limited due to a high risk of COVID-19 transmission. Note, compassionate care visits should be permitted at all times. Those conditions have to do with the current facility outbreaks, if the county where a facility is located has a high positivity rate, or if the resident is currently in quarantine after exposure. While some variation is expected and certain visitation restrictions are common, caregivers say they're losing patience. Last week, State Health Commissioner Dr. Christina Box said families can file complaints with Indiana's Department of Health if their loved one's facility isn't following state or federal guidance.
Visitation inside should be open pretty much at all times. It shouldn't be just a half an hour visit anymore. And if you're having struggles with that, our website will have this information and how we've directed the long-term care facilities.
Box also insists ombudsmen can be valuable resources, but for caregivers, the prospect of lodging a state complaint can be a loaded decision. Mary Charlson is the primary caregiver for her mother, also named Mary. Her facility restricts visiting hours, and that makes her twice-daily visits complicated. Currently, she has to rush home after her school bus route to ensure she can make the facility's final appointment.
Okay, 424, backing out of my driveway right now. Thank God my mom is only a little over 3 miles from my house. Off to visit.
This is a place that my mom is going to be probably for the rest of her life. So would I want to burn any bridges? No. No. Do I feel like the employees that are in there are care for my mom and love my mom? Yes.
Charleston doesn't blame the facility's staff and insists they've provided good care for her mom, but she wishes the facility's corporate owners would provide more clarity on their visitation policies. Zach Cattell, the president of the Indiana Healthcare Association and Indiana Center for Assisted Living, believes facilities will meet the guidance quickly as they have with past policy changes.
Visitation was never an issue prior to the pandemic, and I think everyone is eager to return to normalcy within the ambit of these being open and welcoming communities. We're coming out of a years-long restriction with a lot of still nuanced guidance that we have to follow. So I think just a little bit of grace for folks as they figure out these intricacies of what's restricted and what's allowed based on the state and federal guidance is helpful. I don't think anybody's purposely dragging their feet.
Charleston largely agrees, but struggles to understand the logic behind the policies. Her mom is fully vaccinated, and Charleston says she'll soon receive her second dose.
They should want us to be able to see our loved ones, and they should want to be able to have the residents happy.
Charleston's mom resides in a facility owned by American Senior Communities, and visitation policy varies widely within its facilities. Representatives from at least 3 American senior-owned communities say the facilities were not allowing in-room visitation. Other facilities by the same group said in-room visits were permitted from 8 a.m. to 8 p.m. One ASC facility said it was allowing in-room visits only to those vaccinated, something federal guidance prohibits. The company provided a statement, but did not address the variation or a specific facility's policy. It's not just American Senior Communities. Caregivers in other facilities describe vastly different experiences when coordinating visits with loved ones. Charleston believes regulators should publish more strict guidance.
They're not making it mandatory. So then if a facility decides to go ahead and do this and something happens that it escalates, then it's their problem.
She says her and her mother look forward to the day when they're able to go outside for a walk or enjoy a carry-out pizza from the nearby Pizza Hut.
She'll ask me, if she can go somewhere with me. And I have to always tell her, no, you can't. You can't go with me, Mom. I'm sorry. We have to wait.
But for now, Charleston is just grateful to have the opportunity to hug and sing to her mom in person and not through a window on a stepladder.
When you're feeling sad and lonely, all you gotta do is hop in there. That's right. And I'll be here. Yay!
For Indiana Newsdesk, I'm Brock Turner.
We can hug each other.
Coming up next on Indiana Newsdesk. The pandemic has taken a devastating toll on the restaurant industry. Ahead, how new federal money could help ease the burden for some. And U.S. Forest Service staff and volunteers are working to eradicate the invasive garlic mustard plant from the Hoosier National Forest. These stories and more right here on Indiana Newsdesk.
Welcome to Amanpour on PBS. I'm Christiane Amanpour in London, giving you the global view. I've covered the world for nearly 3 decades, and I'm dedicated to bringing you all the facts. Please join me for conversations with newsmakers, world leaders.
Good to be with you, Christiane.
Artists and writers, the people who define, change, and challenge our world. That's Amanpour on PBS.
Ready to watch the best of PBS anytime, anywhere, on nearly any device? It's easy with the PBS Video app. Simply download the PBS Video app on your mobile or streaming device. Now you can watch the latest PBS episodes or catch up on the shows you missed, discover new favorites from PBS, and local content from your PBS station.
Welcome back to Indiana Newsdesk. Since the start of the pandemic, no industry has faced financial hardship more than restaurants. The recently passed American Rescue Plan Act is making a considerable effort to save these businesses with more than $28 billion of federal money. But as our Ethan Burks reports, the help came too late for some local establishments.
The Standard Grain restaurant opened just north of Bloomington's downtown square with the goal of bringing a variety of new flavors into town. But then the most unforeseen events unfolded.
We opened 8 days before the pandemic, and of course you can't predict a pandemic, and there's nothing we could have done about that, but we opened full-fledged. We had a great first 2 weeks opening, fantastic sales, tons of people, great feedback from the community.
Without any notice, Bayer and her staff were vulnerable to the COVID-19 shutdown and economic collapse that American small businesses were facing everywhere.
We thought about delivery, it just wasn't going to work. We had such a small staff. It was really disheartening to have to let a few people go, but in order to survive, we had to do what we had to do.
Bayer says after a few months passed, business began to pick up. And from May through September, things weren't looking too bad. But then winter set in. COVID cases hit new highs, and business plummeted. Bayer and her team decided to close for the holidays and reopen in early 2021.
Our decision was based solely off the fact that we were planning on a PPP loan. And unfortunately, we did not qualify for that because we were not open in 2019 and could not show a loss for 2019.
The way the government and banks distribute loans is mostly based off of both past and projected revenues, which is something Standard Grain had neither of.
Many businesses, especially food businesses, live pretty close to the ground. They're not check to check, but there's just not a lot of cushion in food service operations.
The city of Bloomington launched its own program to help businesses struggling to stay afloat during the pandemic. The $2 million fund came out of the local food and beverage tax money that was set aside to build a new Monroe County Convention Center.
So initially we conceived of this as a bridge program to help get cash into the hands of local businesses while they awaited their larger federal support.
One of the longest standing local restaurants, Nick's English Hut, was one of the recipients of those loans.
When you're not expecting to go in debt and you are forced to go in debt and don't know how you can pay it because you don't have the revenue to equate to paying it back, it's scary.
Nick's has been a Bloomington staple for nearly a century, but Bright says that didn't make it any easier.
I tell you, everybody I talk to thought, oh, Nick's is okay, we're making a profit. I'm like, no, we haven't had a profit since last February. It's like, really? I said, yeah, it's devastating, guys. Restaurants are up the creek.
Bright says her restaurant revenue is down 50%, and it wasn't until last week that Nick's was approved for a second round of PPP loans.
I'm looking now at the end of this year, and I see a little light at the end of this dark tunnel for restaurants that have been able to partake in these loans and grants and be wise and spend more frugally.
Nick's has been given more than $1 million in loans and grants over the course of the past year. And with the weather warming up, Bright finally sees an opportunity to stay afloat without government assistance. Nick's and other downtown restaurants have the advantage of being able to use Kirkwood Avenue for more outdoor seating on the sidewalks and street to get more people down here to eat. This is a measure the city started last year and will continue this weekend for the foreseeable future. But for Bayer and her restaurant, it's too late. The timing and financial circumstances just didn't work out.
It's a hard market to find an opportunity, but I have complete faith that something will open and when the time is right.
For Indiana Newsdesk, I'm Ethan Burks.
The Independent Restaurant Coalition confirms the industry is slowly recovering, and even though business is still below pre-pandemic levels, Indiana is the top state in the Midwest in sales and revenue. Independently owned restaurants are expected to be eligible to apply for funds through the American Rescue Plan in early April. All bars and restaurants with fewer than 20 locations are able to apply. Well, a new study is out according to the U.S. Geological Survey in collaboration with the Centers for Disease Control and Prevention. And as Indiana Public Broadcasting's Rebecca Theo reports, arsenic naturally occurs in the ground, but long-term exposure to the metal in drinking water can increase your risk for all kinds of health problems.
The USGS estimates more than 2 million people around the country already have unhealthy levels of arsenic in their private wells. But under drought conditions, that number goes up to about 4 million. USGS hydrologist Melissa Lombard says Indiana tends to have high levels of arsenic in the groundwater and more people on private wells.
So those two in combination result in Indiana being at a higher risk than a lot of the other states.
Lombard says a drought might cause the water to move differently in an aquifer or change its chemistry, resulting in more arsenic.
If you run out of water, that's a problem. But we're only really starting to think about how that might impact, a drought might impact the water quality and human health.
The Midwest is expected to experience more periods of droughts in the future. The Indiana Department of Health recommends testing your private well at least once a year. For Indiana Public Broadcasting, I'm Rebecca Thiel.
Well, it's officially spring, and Hoosiers who want an excuse to get outside are in luck. The U.S. Forest Service needs help fighting invasive species. George Hale followed specialists hunting one particularly dangerous plant at the Hoosier National Forest.
U.S. Forest Service staff and volunteers armed with gloves and plastic bags were out Saturday pulling up garlic mustard by the root at Blackwell Horse Camp south of Bloomington. The weed can grow up to 6 feet tall, but forest officials try not to let it get that far.
So it puts a chemical in the soil that inhibits other plants from growing, which is bad, and it also shades them out. So especially here around a horse camp where horses are eating everything, I want to make sure that they're not picking up that garlic mustard, which is really bad for the habitat, and taking it somewhere else that we can't get to.
Saturday's Volunteer Day was the first of the year, and officials will be working on garlic mustard in different areas of the forest throughout the spring. Phelps says volunteers don't need to know much about invasive species to make a difference.
I wish I could say it's really hard to find them, but it's pretty common, and in the spring especially, because they're one of the only things that's green right now. So it's really easy to find them, in especially areas where you have streams, you have trails, you have roads. You're going to find it about everywhere.
We just pull them out of the ground. Many of us carry a little trowel so that we can make sure that we get the whole root and that it won't re-sprout. And then we put them in bags and remove them from the forest.
Ellen Jakehart was out volunteering Saturday, a former botanist for Hoosier National Forest. She says the biannual produces tens of thousands of seeds during the second year.
One of the great things about Monroe County are all the beautiful wooded natural areas we have. And in the next month, they come into their glory. And you have spring beauty and harbinger of spring and celandine poppy and blue phlox and jack in the pulpit. But if you have garlic mustard, that's all you have. One by one, it takes out all those other species and takes over the entire ground layer.
Experts say the weed showed up in Indiana in the 1950s or sooner, but didn't reach Blackwell for a few more decades. Jakehart says once it arrives, it's hard to eradicate completely. Officials have to stay vigilant to protect the forest, and they need help.
And I remember when we first found garlic mustard here at the horse camp, probably brought in on horse hooves, and we were not able to get it under control, and so here we are 20 years later, still chasing garlic mustard and trying to keep it from taking over this forest.
The next Volunteer Day is April 10th. For Indiana Newsdesk, I'm George Hale.
The Indiana women's basketball team won its first 2 NCAA tournament games this week to reach the Sweet 16 for the first time in school history. Pat Bean reports on the 12th ranked Hoosiers.
It's all about defense for the Indiana women's basketball team. In their first 2 NCAA tournament games, the Hoosiers have held their opponents to 80 points combined.
Our kids know who they are, and they know why we've won the amount of games that we've been able to win this year and in years past is because we do one thing. We work extremely hard on the defensive end.
The Hoosiers allowed just under 60 points a game this season when they climbed into the top 10 before finishing number 12 in the nation. And with a 20-5 record, Indiana earned a 4th seed for the tournament. The Hoosiers faced top-seeded North Carolina State Saturday in San Antonio.
I believe so much in this group that I do believe that we got some momentum, and it's going to carry over into the next round. Our best basketball is going to be ahead of us.
Indiana thought it would be in this position last year. They finished ranked 22nd in the nation and set a program record with 24 wins. But less than a week before the NCAA tournament pairings were to be announced, the pandemic hit and the postseason was canceled.
We talked a lot about last March 11th when things got shut down, and just how disappointed we were sitting in that locker room and that being it. We didn't have any time to prepare for something like that.
The core of that team, senior Allie Patberg, junior Grace Berger, and sophomore Mackenzie Holmes, returned determined to get back to the tournament. and make the most of it. For Indiana Newsdesk, I'm Pat Bean.
Well, a building that stood for about a century in Bloomington came down this week. You probably know it as the former Players Pub, but the Boxman Mitchell building on South Walnut Street was home to Boxman's Restaurant from 1929 to 1958. Owner Henry Boxman was the first person to display a neon sign and install air conditioning in a Bloomington restaurant. The Players Pub occupied the building from 2005 to 2018. The building's current owner said it was in need of hundreds of thousands of dollars in repairs. He got permission to tear it down, but says he doesn't have any plans for the property. And that's the end of this program, but our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.